Hey guys, welcome back to the channel. Thanks for joining us. Any good general surgeon worth their weight in salt will tell you about constipation stories till the end of time. For that matter, any human who's ever lived will tell you about constipation jokes. But I tell you, some of the most challenging times I had in my career were when people couldn't poop. And so that's what we're going to talk about today. Constipation. What is it? What causes it? How do you treat it? And how do you prevent it? So welcome to the channel. Hey guys, I'm Dr. Nene, a US trained cardiac, thoracic, and vascular surgeon and a general surgeon. As a healthcare innovator and a health tech innovator, I want to empower you to your best health ever. On this channel, we will share evidence-based medicine from all of us to you through our experiences and training about health and healthcare. The goal is to help you make informed decisions about your own health as well as that of your loved ones. We're here for you, so don't hesitate to reach out. So let's face it, every single one of us has been constipated one time or another. In a career in general and cardiothoracic surgery, I can tell you the use of medications and all that would cause a huge amount of constipation. So I remember that day on rounds when we had gone in. I had a patient who hadn't had a bowel movement in 3 days. And you don't know how grumpy people get, or maybe you do. And I asked her, what else can we do? We've given you laxatives, we've given you fiber-forming agents, we've given you pills which create water intake, we've given you adequate hydration. And this cute little old lady said to me, well, doc, do you got any dynamite? At that point, we fell down laughing. I mean, let's call it what it is. When your bowels aren't moving, it's not a happy world. And in fact, when we looked at this worldwide, up to 16% of the people in the US are constipated at any given time. And in the age group of 60 and greater, it doubles. When we looked in India, Abbott produced a very, very landmark study which showed in 2018 that when they did a survey of people, they found up to 22% of people had some level of constipation. And you would think in India, of all places, where we eat a lot of fiber in our diet, a lot of vegetables and other things, people were still getting constipated. More importantly, when we looked at this, in the cities, it was even more prominent. In fact, up to 13% of these patients had severe constipation, and 6% of the population suffered from constipation, which was associated with other comorbidities like diabetes, heart disease, and other things. So let's talk a little bit about that. What is constipation? It's defined in various ways. The most common way is when you have fewer than 3 bowel movements per week, stools that are hard, dry, and lumpy, and stools that are difficult to pass or painful. And also the feeling that you haven't really evacuated your bowels. And the real issue with this is it's not as clear-cut as that. In some people, they only have 1 bowel movement per week. In other people, they have 3 bowel movements in a day. And so the normal is not normal. But let's face it, you know when you're constipated. So what causes constipation? Let's take a step back and think about what the job of the colon is. I know everyone jokes about colons, but the bottom line is the colon is responsible for dehydrating all of the fluid in your waste. And then with a combination of the muscles and then bacteria breaking down some of this, the muscles move that waste along and you have your bowel movements. When that doesn't work, that's when you get into trouble. And the most common things which can lead to constipation are a low fiber diet. And we'll talk about soluble and non-soluble fiber, but the idea is that if you're not eating a lot of fiber in your diet, you can't form well-formed stools. The second thing is if you're dehydrated, meaning that you aren't getting adequate water in, then what happens is the stool becomes very hard and lumpy, and it's very difficult for your colon to move along. The third is if you have a delay in the impulse to go to the bathroom. In other words, if you hold it, sometimes it's very difficult to reset that, and the stool can impact, and in the worst circumstances, and I can tell you in the hospital, you have to disimpact physically a patient that is fully impacted. and use other means to take that out. So it can become a very dangerous thing. And so the point is, if you feel like going to the bathroom, don't delay, go. Now that's easier said than done sometimes, particularly in India. And so we'll get to this, but the bowel regimen, when you have your bowel movements every single day, has to be mapped out and has to be observed. And I think the elders in our community will know that they won't even leave the house sometimes until they've had their first bowel movement of the day, so that they don't have issues when they're out and about. And in India, we don't always have good sanitation everywhere. Next is changes in your routine can cause constipation. For instance, travel, for me, becomes very difficult. If you're flying from India to the US, where there's a 12-hour, sometimes, time zone change, the bowels aren't used to that. And then you might not be in the start of the day or the end of the day whenever you have your normal bowel movement. And I joke about this, but I say we know you're over jet lag when you have got your bowel regimen back on track, meaning that you're having your bowel movements at the same time as you normally have it, either in the morning or the evening. But honestly, travel does pose an issue there. Then there's medications which can lead to constipation. The most common of these is narcotic agents, which slow down bowel transit and can, in some cases, even paralyze how the bowels move. Other things which can do it are diuretics, which dehydrate you physically, and also some of the treatments for Parkinson's, which will affect the nerves in the mesenteric ganglions and the nerves which dictate how the bowels move. Other things which can cause constipation are pregnancy. You can imagine a very gravid uterus, a pregnant uterus, can obstruct flow and put pressure on different parts of the bowel, causing areas to not be able to move the stool along. When that happens, a couple of things can happen. That area continues to dehydrate the stool and it becomes very hard and lumpy. And once it gets to that point, moving it along can be very difficult. The last thing is, as you get older, and in particular patients over the age of 60, almost a third of them will have issues with constipation. And many people ask me why that's the case. It could be due to a couple of things. One is your bowel transit time may change as you age, and the bowel's nervous systems may not act as diligently. The second is you may have issues with emptying in your bowels and, due to other complications like hemorrhoids and other things like that. But what is clear is as you get older, you have to make sure that you maintain your bowel regimen on a regular basis. How do we treat constipation in a surgical setting? And what's abundantly clear is you have to correct the things which cause it. Like you have to hydrate people if they're dehydrated. You have to limit things which will dehydrate them. Either drugs, alcohol, or caffeinated drinks will do that in the non-hospitalized segment. And in the hospitalized segment, if we're hitting them with diuretics, we got to make sure that they're on agents which will help their bowels move. The next is to add fiber-rich foods to their diets. And the interesting thing is meats, cheeses, eggs are not fiber-rich. And if you are a carnivore, there's a good chance if you don't eat vegetables with it, meaning leafy greens or high-fiber vegetables, that you will have constipation. We've talked about the different things which can help you in your life, and one of them is exercise. That actually helps with bowel transit and also with the musculature of your abdomen in doing that. The other interesting thing is in Indian toilets, in the olden style, people would squat. And that actually works because what it does is it adds pressure to the abdomen and also straightens out the path of the stool. So there is some science to the fact that 4,000-year-old culture of squatting to go to the bathroom is helpful in bowel movements. And it's also kind of held up in yoga as well, in training your bowels. And then if that doesn't work, what we started with in the surgical regimen was to start with bulk forming laxatives in the way of fiber and things you could put in water and drink. We would also add a stool softening agent to that, and we would start them on it. Now that works if in preventing constipation. And the analog of that in real life would be in eating lots of fiber-rich foods like salads and other things which have a lot of fiber in them. In the Indian diet, if you're vegetarian, in general, you'll get enough fiber. Meanwhile, if you are constipated, what do you do? And we had different degrees of this. If you're at the point where you have abdominal pain and haven't defecated in a long period of time, you need to go see a doctor and potentially go to the hospital. But the other tricks of the trade were to use a suppository which would stimulate the bowels to move. The other thing you could do in that is also use an enema. And enemas come in different types. Some are just pure water, some are soap suds, some are mineral oil. And what they do is to stimulate your bowels to defecate, as well as lubricating the canal so that the stool can come out. And particularly with hardened stools, that works. Then in a clinical setting, we would use high volume enemas, which would basically go in there and flush everything out. And then on the flip side, you could also take different types of osmotic laxatives, which basically would suck water into the bowel and act to flush everything out from above, like milk of magnesia or things like that. Finally, the other solution, if all that didn't work and you had literally a plug, is you could do something called a disimpaction. Not the funnest thing as a general surgeon, but you'd have to basically dig it on out so that the bowels could move. And then in the worst case scenario, and we seldom had to do this, you would have to take them to the operating room and under anesthesia do this, and either do the impaction there, or in the worst case, if you had a bowel which was dilated and had real issues, you would have to operate on them and bypass them or do things like that. So anyway, tell us in the comments below if you've ever had constipation and how you deal with it. What we've tried to do is summarize how you can deal with it in a real world setting. Look, it's very, very frustrating. And I think all of you have had it. And then the last thing is, as you get older, you got to be even more vigilant. So tell us what your thoughts are on that. And as always, if you like what I'm saying, hit the like button. If you want to share it with everyone, that would be great. And then hit the bell icon so that you can be notified as we put out even more interesting videos. And lastly, in the comments below, tell me what your thoughts are on this and how you deal with it, and also what other topics you want us to cover. Thanks so much for joining us, and I look forward to talking to you.